How do we effectively manage the common skin condition known as acne in primary care? This forms the crux of our discussion today. Acne, a condition affecting millions, is far more than just a cosmetic issue. It is a widespread health concern that varies in types, from whiteheads to more severe forms like cysts. Factors such as hormones, bacteria, certain medications, diet, and stress can trigger its onset. Its extensive occurrence underscores the vital role primary care plays in diagnosing, treating, and preventing acne. Hence, gaining an understanding of acne and its various facets is pivotal for its effective treatment. So now, shall we embark on this exploratory journey into the realm of acne treatment within the context of primary care? In understanding acne treatment in primary care is vital. It is more than just dealing with skin issues. It's about maintaining overall health, preventing further complications, and enhancing one's quality of life. Therefore, we encourage you to watching this video to further enrich your knowledge and be acquainted with the different aspects and solutions to this prevalent health predicament. By doing so together, we can take a significant step towards a healthier future. Acne is more than just an aesthetic concern. It's a condition that can cause discomfort and affect self-esteem. But to understand acne, we need to decode some medical terms. Let's begin with comedones. These are what we commonly call whiteheads and blackheads, small bumps that appear when a pore in your skin gets clogged. They're the earliest form of acne and can develop into other types if not treated properly. Then we have papules, which are small, red, tender bumps with no head. Unlike comedones, these are inflamed and can be sensitive to touch. Next up are pustules. Now, these are what most people picture when they think of acne. They're similar to papules but have a white tip in the center caused by a buildup of pus. And finally, nodules. These are large, solid, painful lumps beneath the surface of the skin, and they're usually a result of severe acne cases. Now, what causes acne? Well, it's a mix of factors, including hormonal changes. For instance, during puberty, the body produces more androgens, a type of hormone that enlarges oil-producing glands in the skin, leading to excess oil production. This excess oil, along with dead skin cells, can clog pores, creating a perfect environment for a type of bacteria called Propionibacterium acnes to thrive. This bacteria causes inflammation and the formation of acne lesions. Understanding acne is the first step towards effective treatment. With this knowledge, we can better identify and manage this common but often misunderstood skin condition. So, how do healthcare professionals approach acne treatment in primary care? That's a question we find ourselves asking quite often. To answer it, let's delve into the role of primary care in managing acne. Primary care providers play a crucial role in the initial evaluation and treatment of acne. They're usually the first line of defense, assessing the severity of the condition, exploring potential triggers, and recommending appropriate interventions. This process is not just about looking at the skin. It's about understanding the individual's lifestyle, habits, and overall health. Speaking of lifestyle, modifications can significantly impact acne management. Simple adjustments, such as maintaining a balanced diet, staying well hydrated, and ensuring adequate sleep, can make a world of difference. Regular exercise is also encouraged as it helps reduce stress, a known acne trigger. However, lifestyle changes are typically supplemented with treatments for a more comprehensive approach. Now, this is where topical treatments come into play. They form a large chunk of the primary care arsenal against acne. These treatments work by reducing oil production, speeding up skin cell turnover, fighting bacterial infection, or reducing inflammation. Over-the-counter products often contain ingredients like benzoyl peroxide, salicylic acid, or sulfur. But what if these aren't enough? Enter prescription acne treatments. These are usually stronger and can tackle more stubborn or severe forms of acne. They might include topical retinoids, topical antibiotics, or even oral medications. The choice of treatment depends on the type and severity of acne and the patient's individual health profile. It's important to note that acne treatment is not a one-size-fits-all situation, and what works for one person might not work for another. It's a process of trial and error, and sometimes it can take a while to find the right treatment combination. So, as we wrap up this discussion on acne treatment in primary care, there's one thing to keep in mind. Remember, patience is key when it comes to acne treatment. It might take some time, but with the right approach and guidance, clear skin is attainable. But what happens when primary care treatments aren't enough? In such cases, referral to a dermatologist may be the next best step. There are several key indicators that can signal the need for this transition. Severe acne, for instance, is a clear sign. This type of acne often includes nodules and cysts which are larger, deeper, and more painful than regular spots. They're more likely to cause scarring, making them a significant concern that warrants a specialist's attention. Next is the lack of response to treatment. If primary care interventions like over-the-counter products, prescription creams, or antibiotics are not showing results, a referral might be necessary. Dermatologists have access to a wider range of treatments and may be able to prescribe something more potent or suited to the individual's skin type and condition. Significant scarring or hyperpigmentation is another indication. These issues can have a major impact on a person's self-esteem and quality of life. A dermatologist can offer effective treatments that minimize these effects, such as laser therapy or chemical peels. Early referral can be a game changer. It's not just about clearing up the skin, but also preventing long-term damage. The sooner a dermatologist is involved, the better the chances are of avoiding deep scars and other permanent skin changes. So, when dealing with acne, it's crucial not to underestimate the situation. It's not just a cosmetic issue, but a serious skin condition that can have lasting impacts. Knowing when to refer can make all the difference in acne treatment. Acne isn't just skin deep. This statement is more than a cliché. It's a reality that many people with acne experience daily. The physical manifestations of acne are only one aspect of this condition. The emotional and psychological impact can be equally, if not more, significant. Acne can be a source of immense psychological distress, leading to feelings of embarrassment, frustration, and even social isolation. It can erode a person's self-esteem, making them highly self-conscious about their appearance. This can impact their social interactions, academic performance, and overall quality of life. Depression and anxiety are also common among individuals with acne. The constant worry about their skin, coupled with the societal pressure to have flawless skin, can induce a state of chronic stress. This can exacerbate their acne condition, creating a vicious cycle that's hard to break. In a primary care setting, it's crucial to acknowledge and address these psychological impacts. Healthcare professionals play a pivotal role in providing emotional support to patients. It's not just about prescribing medications or treatments, it's about understanding their struggles, validating their feelings, and helping them navigate through their acne journey. One way to do this is by fostering open and empathetic conversations. Encourage patients to express their feelings and fears about their acne. Assure them that it's okay to feel upset or frustrated about their skin. Remind them that their worth is not defined by their physical appearance. Another strategy is to educate patients about the nature of acne. Help them understand that it's a common condition and not a reflection of their hygiene or lifestyle habits. This can help dispel any self-blame or guilt they may feel about their acne. Referring patients to mental health professionals when necessary is also vital. Mental health experts can provide targeted therapies to help patients cope with their emotional distress. They can equip patients with effective stress management techniques and strategies to boost their self-esteem. Never underestimate the psychological impact of acne. It's a silent battle that many patients fight every day. As healthcare professionals, we have the opportunity and responsibility to support them in this battle, beyond just treating their skin. So, what's the best way to handle acne in primary care? This question is where we began, and it's where we're going to wrap things up. Let's revisit the major points we've covered. Understanding acne is our first step. We've learned about the different types of acne, from your common blackheads and whiteheads to the more severe nodules and cysts. The causes are multifaceted, and they can range from hormonal changes to stress, and even diet. Understanding these factors is key to managing the skin condition effectively. Then, we dove into the crucial role of primary care in the treatment of acne. We've learned how primary care physicians are often the first point of contact for patients. They're in a unique position to offer early intervention, provide appropriate treatments, and monitor progress. Primary care is not just about prescribing creams or medications, it's also about providing patient education and encouraging adherence to treatment plans. Next, we explored when to refer a patient to a dermatologist. Complex cases such as severe or persistent acne, or cases where scarring is a concern, may require the expertise of a specialist. The primary care physician's role doesn't end with a referral, though. Ongoing communication between the primary care physician and dermatologist is essential for optimal patient care. Lastly, but definitely not least, we touched on the impact of acne beyond the physical. We talked about the psychological toll it can take, leading to issues like depression, anxiety, and low self-esteem. It's crucial to remember that acne is not just a skin problem, it's a condition that can deeply affect a person's quality of life. So to sum it all up, effectively managing acne in primary care is a multifaceted task. It requires understanding the condition, providing appropriate treatment, knowing when to refer, and acknowledging the psychological aspects of the condition. It's a journey that requires patience, empathy, and a holistic approach. Remember, treating acne effectively is about more than just clearing skin. It's about improving lives. So let's use the knowledge we've gained to make a difference in our patients' lives. Every step we take in understanding and treating acne brings us one step closer to that goal.